Hello everyone, I, Dr. Usha Balan, Associate Professor from the Department of Oral Pathology, KMCT Dental College, in association with IDA Malabar, would like to give you a brief insight on biopsy, what a clinician should know. Biopsy is the view of living. Now the question arises as who can perform biopsy? Any competent clinician who is confident enough can perform this procedure. Now, there are various techniques of biopsy, but frequently in clinical practice, we follow incisional biopsy, where a portion of the large lesion is incised and sent for microscopic examination. If the lesion is small, the entire lesion is removed en toto and sent for histopathological analysis. Needle biopsy is preferred for salivary gland lesions and bone lesions or fluid-filled lesions. Here, a wide bore syringe with a 22-23 gauge needle is inserted into the lesion. A negative suction is created and the contents are aspirated. These contents are smeared on the slide and it is fixed with 95% ethyl alcohol or a spray fixative and sent to the laboratory for further investigation. Exfoliative cytology is an adjunct for biopsy wherein the surface desquamated cells are scraped using a cytobrush or a spatula and it is smeared on the slide and fixed with 95% ethyl alcohol or spray fixative and sent for cytological investigations. Now we'll discuss few points what you have to take adequate care while performing biopsy. First, when giving a local anesthesia, take care not to inject into the lesion. It should be injected 3 to 4 millimeter away from the lesion, or a block anesthesia would be more preferable. Do not apply any antiseptic paint on the surface of the lesion. Selection of representative site is the most important aspect while performing biopsy. Now, if the lesion is large, visually examine it, tactilely feel the lesion, and if you can see some red and white areas, you can see some thickenings or indurated areas, these have to be included in your section along with the surrounding normal mucosa. Now for smaller lesions, the surrounding 2 to 3 millimeter normal mucosa also has to be included in the section. For gingival lesions, the section should be broad and shallow as the mucosa is thinner in these areas. For mucosal lesions, the section should be elliptical or wedge shape going deep until the musculature, and avoid multiple cuts. With a single cut, excise the lesion off. And once it is excised, gently wash it in running water. The tissue has to be handled very gently. Then immerse it into the fixative. Normally we use 10% formalin. This fixative should be taken in a wide mouth clear bottle. The tissue has to be completely immersed into the fixative. The volume of the fixative should be 10 to 25 times the volume of the tissue. And close the lid of the bottle and seal it immediately so that the formalin does not spill over during transportation. Now for vesiculobullous lesion, an intact bulla is ideal, or the perilesional tissue has to be included in the section. And if you are sending the section for immunofluorescence study, it has to be fixed in Michel's reagent, which is a commercially available transport media. Never fix it in formalin as it will damage the antigen. Label the bottle immediately. All the details regarding the patient has to be mentioned on the bottle. Along with this, a clinical detail form, that is all the clinical details of the patient, the personal details, any chairside investigation or any radiographic investigation, their report has to be shared with the pathologist. The tissue that is received in the laboratory has to be processed, prepared, and the slide has to be prepared and then viewed under the microscope. The ultimate goal is to obtain a representative tissue sample to facilitate histological interpretation for a better treatment outcome. It takes about 5 to 7 days duration for the report to be dispatched. Effective communication is essential between the clinician and the pathologist for a better treatment outcome. Thank you organizing members for giving me an opportunity to talk on this special day, that is the National Oral Pathologist Day.